1. A nurse is caring for a patient with a new diagnosis of diabetes. The patient is hesitant to make lifestyle changes. Which action should the nurse take first? Answer. The nurse should assess the patient's understanding of the disease and their concerns about the diagnosis. Rationale. Assessment is the first step in the nursing process. Understanding the patient's knowledge and concerns will guide the nurse in providing appropriate education and support for lifestyle changes. 2. A nurse is preparing to administer a medication to a patient who refuses to take it. What is the nurse's first step? Answer. The nurse should explore the reason for the patient's refusal. Rationale. Understanding the patient's concerns or reasons for refusal allows the nurse to address potential misunderstandings, provide education, and collaborate on an appropriate solution while respecting patient autonomy. 3. A nurse is prioritizing care for 4 patients in a busy emergency room. Which patient should the nurse assess first? 1. A 65-year-old with chest pain and diaphoresis. 2. A 45-year-old with a minor laceration. 3. A 30-year-old with a headache and dizziness. 4. A 50-year-old with a fever and cough. Answer. The nurse should assess the 65-year-old with chest pain and diaphoresis first. Rationale. Chest pain with diaphoresis in a patient over 60 years old is a potential indication of a myocardial infarction, which requires immediate attention. 4. A nurse is caring for a patient postoperatively who is confused and disoriented. Which intervention should the nurse implement first? Answer. The nurse should ensure the patient's safety by keeping the bed in a low position and using side rails if necessary. Rationale. The priority for a disoriented patient is to prevent injury. Ensuring the bed is in a low position and considering side rails will reduce the risk of falls. 5. A nurse is delegating tasks to a nursing assistant. Which task can be safely delegated to the assistant? 1. Administering oral medications. 2. Collecting a urine specimen. 3. Teaching a patient about postoperative care. 4. Assessing a patient's vital signs. Answer. The nurse can delegate the task of collecting a urine specimen to the nursing assistant. Rationale. Collecting a urine specimen is a non-invasive, straightforward task that falls within the scope of practice of a nursing assistant, while the other tasks require nursing judgment and knowledge. 6. A nurse is preparing to discharge a patient with a new prescription for anticoagulation therapy. Which of the following is the most important teaching point? Answer. The nurse should teach the patient the signs and symptoms of bleeding and when to seek medical attention. Rationale. Anticoagulants increase the risk of bleeding, and it is crucial for the patient to understand when bleeding is a concern to prevent serious complications. 7. A nurse is caring for a patient with a history of alcohol abuse who is experiencing tremors, agitation, and increased blood pressure. What is the most likely cause of these symptoms? Answer. The most likely cause is alcohol withdrawal. Rationale. Alcohol withdrawal occurs when a person who has been dependent on alcohol suddenly reduces or stops drinking. Symptoms include tremors, agitation, and increased blood pressure, among others. 8. A nurse is caring for a patient with a high fever. The nurse anticipates that which laboratory value will be elevated? Answer. The nurse should expect an elevated white blood cell WBC count. Rationale. A high fever typically indicates an infection, which stimulates the body's immune response, leading to an increase in WBC count. 9. A nurse is administering a blood transfusion to a patient. Which action should the nurse take first if the patient begins to experience chills and back pain during the transfusion? Answer. The nurse should stop the transfusion immediately and assess the patient's vital signs. Rationale. Chills and back pain are early signs of a transfusion reaction. Stopping the transfusion immediately and assessing the patient will help prevent further complications. 10. A nurse is caring for a patient who has a history of chronic obstructive pulmonary disease, COPD. Which of the following would be the most concerning finding? Answer. The most concerning finding would be a sudden increase in respiratory rate and use of accessory muscles. Rationale. A sudden increase in respiratory rate and the use of accessory muscles indicate respiratory distress and potential worsening of COPD, which requires prompt intervention. 11. A nurse is caring for a patient with a central venous catheter, CVC. What is the most important measure to prevent infection? Answer. The nurse should follow strict aseptic technique when handling the CVC and ensure that the dressing is kept clean and dry. Rationale. Strict aseptic technique minimizes the risk of infection associated with CVCs, and keeping the dressing clean and dry helps prevent contamination. 12. A nurse is preparing to assess a patient who is experiencing severe abdominal pain. Which of the following assessments should be performed first? Answer. The nurse should assess the patient's vital signs first. Rationale. Vital signs provide essential information about the patient's hemodynamic status and can help identify signs of shock or other critical conditions that require immediate attention. 13. A nurse is caring for a patient postoperatively who is experiencing nausea and vomiting. Which intervention should the nurse implement first? Answer. The nurse should assess the patient's abdomen for distension or other abnormalities. Rationale. Assessing the abdomen helps the nurse identify potential complications, such as bowel obstruction or ileus, which may require further intervention. 14. A nurse is caring for a patient with a stage 2 pressure ulcer. What is the most important intervention for the nurse to implement? Answer. The nurse should implement measures to relieve pressure on the affected area, such as repositioning the patient frequently. Rationale. Repositioning the patient frequently is crucial in preventing further tissue damage and promoting healing of a pressure ulcer. 15. A nurse is caring for a patient who has just been diagnosed with cancer. The patient expresses anger and frustration. Which response by the nurse would be most therapeutic? Answer. The nurse should acknowledge the patient's feelings by saying, "I can see that you're feeling angry and frustrated. Let's talk about what you're going through." Rationale. Acknowledging the patient's emotions and offering to talk provides emotional support, helping the patient feel understood and allowing for expression of feelings. 16. A nurse is caring for a patient receiving opioid analgesics. What is the priority assessment before administering the medication? Answer. The priority assessment is the patient's respiratory rate. Rationale. Opioids can depress the respiratory system, and assessing the respiratory rate ensures that the patient is not at risk of respiratory depression before administering the medication. 17. A nurse is caring for a patient who is about to undergo surgery. Which of the following actions is most important for the nurse to take before surgery? Answer. The nurse should verify the surgical site with the patient and the surgical team. Rationale. Verifying the surgical site is crucial for patient safety and to prevent wrong site surgery. This step is part of the surgical safety checklist. 18. A nurse is caring for a patient who is receiving enteral feedings. Which of the following is the most important action to prevent aspiration? Answer. The nurse should elevate the head of the bed to at least 30 degrees during and after feedings. Rationale. Elevating the head of the bed reduces the risk of aspiration by promoting proper digestion and preventing regurgitation. 19. A nurse is caring for a patient with a history of congestive heart failure, CHF. Which of the following symptoms should the nurse report immediately to the healthcare provider? Answer. The nurse should report a sudden increase in the patient's weight. Rationale. A sudden increase in weight may indicate fluid retention, which could be a sign of worsening heart failure and requires prompt medical intervention. 20. A nurse is caring for a patient with a newly diagnosed neurological disorder. The nurse should first focus on what aspect of care? Answer. The nurse should first focus on assessing the patient's functional abilities and providing education about the condition. Rationale. Assessing functional abilities helps guide the nurse in planning care and providing education, which empowers the patient to manage their condition. 21. A nurse is preparing to administer a medication to a patient who has a history of anaphylaxis to penicillin. What is the nurse's priority action? Answer. The nurse should verify the patient's allergy to penicillin before administering any medication. Rationale. Verifying allergies is crucial to prevent life-threatening allergic reactions, such as anaphylaxis. The nurse must ensure no penicillin or related drugs are given to the patient. 22. A nurse is caring for a patient with a fractured leg who is in traction. Which of the following is the most important action to maintain the integrity of the traction? Answer. The nurse should ensure that the weights are hanging freely and that the ropes are not tangled. Rationale. The weights in traction must be hanging freely to ensure proper alignment of the fracture. Any obstruction or tangling could lead to ineffective treatment or further injury. 23. A nurse is assessing a patient post-thyroidectomy. Which of the following findings requires immediate intervention? Answer. A calcium level of 7.2 milligrams per deciliter requires immediate intervention. Rationale. Hypocalcemia can occur after thyroidectomy due to damage to the parathyroid glands. A calcium level of 7.2 milligrams per deciliter is critically low and requires prompt intervention to prevent tetany or seizures. 24. A nurse is preparing a patient for a lumbar puncture. What is the most important action for the nurse to take before the procedure? Answer. The nurse should ensure that the patient has provided informed consent for the procedure. Rationale. Informed consent is essential for any procedure to ensure that the patient understands the risks, benefits, and alternatives. This helps protect patient autonomy and ensures legal and ethical standards. 25. A nurse is caring for a patient with a tracheostomy. Which of the following is the most important action to prevent infection? Answer. The nurse should perform tracheostomy care using sterile technique. Rationale. Using sterile technique prevents the introduction of pathogens into the tracheostomy site, reducing the risk of infection. 26. A nurse is preparing to administer a blood transfusion to a patient. What is the first action the nurse should take? Answer. The nurse should verify the patient's identity and blood type with another nurse before beginning the transfusion. Rationale. The safety of blood transfusions depends on confirming that the blood is compatible with the patient's blood type. This verification prevents transfusion reactions. 27. A nurse is caring for a patient who is being discharged with a new diagnosis of hypertension. What is the most important teaching point? Answer. The nurse should teach the patient the importance of adhering to prescribed antihypertensive medications and lifestyle changes. Rationale. Consistent medication adherence and lifestyle modifications are critical in managing hypertension and preventing complications such as stroke and heart failure. 28. A nurse is caring for a patient receiving an infusion of a medication that is causing irritation at the insertion site. What should the nurse do first? Answer. The nurse should stop the infusion and assess the site for signs of infiltration or phlebitis. Rationale. Stopping the infusion helps prevent further irritation or injury. Assessing the site allows the nurse to determine whether the medication is causing an adverse reaction, like infiltration or phlebitis. 29. A nurse is caring for a patient who is scheduled for a procedure requiring sedation. Which of the following assessments is most important before sedation is administered? Answer. The nurse should assess the patient's airway and oxygenation status. Rationale. Airway patency and oxygenation are essential for patient safety during sedation. Sedation can depress the respiratory system, making it vital to ensure the patient's ability to breathe properly. 30. A nurse is caring for a patient with a new diagnosis of chronic kidney disease. What is the most important lifestyle change for the nurse to discuss with the patient? Answer. The nurse should discuss the importance of controlling blood pressure and avoiding nephrotoxic substances. Rationale. Managing blood pressure is key to slowing the progression of chronic kidney disease. Nephrotoxic substances, such as certain medications, should be avoided to prevent further kidney damage. 31. A nurse is caring for a patient post-abdominal surgery who is experiencing difficulty breathing and decreased oxygen saturation. What should the nurse do first? Answer. The nurse should elevate the head of the bed to facilitate breathing and improve oxygenation. Rationale. Elevating the head of the bed helps open the airways and promotes better lung expansion, improving the patient's oxygen saturation. 32. A nurse is caring for a patient with a deep vein thrombosis, DVT, who is receiving anticoagulation therapy. Which of the following is the priority assessment? Answer. The nurse should assess for signs of bleeding, such as bruising or petechiae. Rationale: anticoagulation therapy increases the risk of bleeding. Monitoring for signs of bleeding ensures that the patient is not experiencing adverse effects from the medication. 33. A nurse is caring for a patient with acute pancreatitis. Which of the following interventions is the priority? Answer: the nurse should maintain the patient's NPO, nothing by mouth, status to rest the pancreas. Rationale: resting the pancreas by withholding food and fluids helps reduce inflammation and prevent further irritation of the pancreas in acute pancreatitis. 34. A nurse is caring for a patient with a urinary catheter in place. Which of the following is the most important nursing action to prevent urinary tract infection, UTI? Answer: the nurse should ensure the catheter is kept clean and properly secured to prevent kinking or dislodgement. Rationale: proper catheter care and securing prevent urinary stasis, reduce the risk of infection, and ensure the catheter is functioning as intended. 35. A nurse is caring for a patient with an ileostomy. What is the most important teaching point for the patient about ostomy care? Answer: the nurse should teach the patient how to empty the ostomy bag regularly to prevent leakage and skin irritation. Rationale: emptying the ostomy bag before it becomes too full reduces the risk of leakage, which can lead to skin irritation and potential infection. 36. A nurse is caring for a patient with a history of seizures. Which of the following should be placed at the bedside to ensure safety during seizure? Answer: the nurse should place padded side rails on the bed to prevent injury during a seizure. Rationale: padded side rails protect the patient from injury during a seizure by cushioning any movement or impact. 37. A nurse is caring for a patient post-mastectomy who expresses concerns about body image. What is the most therapeutic response? Answer: the nurse should acknowledge the patient's feelings and offer resources for emotional support, such as counseling. Rationale: acknowledging the patient's emotions and offering emotional support helps the patient cope with changes in body image and promotes mental well-being. 38. A nurse is caring for a patient who has just been diagnosed with a stroke. What is the priority intervention? Answer: the nurse should assess the patient's neurological status, including level of consciousness and motor function. Rationale: immediate neurological assessment helps identify the severity of the stroke and guides decisions regarding further interventions, such as thrombolytic therapy. 39. A nurse is caring for a patient with a recent diagnosis of tuberculosis, TB. What is the most important measure to prevent transmission of TB? Answer: the nurse should ensure the patient is placed in a negative pressure room and wears a mask. Rationale: TB is transmitted through airborne particles. A negative pressure room and mask help contain the bacteria and reduce the risk of transmission to others. 40. A nurse is caring for a patient who has been receiving a continuous 4 infusion of fluids. What is the priority assessment for this patient? Answer: the nurse should assess for signs of fluid overload, such as edema or shortness of breath. Rationale: continuous 4 infusions can lead to fluid overload, which may cause complications like pulmonary edema. Monitoring for these signs helps prevent adverse outcomes. If you found this video helpful, don't forget to like, subscribe, and share with your fellow nursing students. Hit the bell icon so you never miss an update. See you in the next one. Happy studying!